Very welcome to this evening's webinar. My name is Mary Claire Kennedy, and I'm a peer support pharmacist with the Irish Institute of Pharmacy. We have a really excellent topic today. I think it's the first of our Wednesday webinars back after the Christmas break. And we're joined by three excellent speakers this evening. So the topic of today's presentation is the HSE Knowledge and Skills Framework for Healthcare Professionals working with older people, and what does this mean for you? So our numbers are gradually picking up, but if you've just entered from the waiting room, just so you're aware, the webinar is being recorded. And we will record as well the Q&A afterwards, just in terms of obviously having your name visible, etc. It's up to you whether you want your cameras on or off, but if you could keep your microphones muted for the duration of the webinar. If you're having difficulties at all, best thing to do is leave and rejoin and try logging in again. But we do have admin support on the line here from the IAOP this evening. So if needs be, we can help sort further if we're having issues. Please use the chat function for posing any questions, and if perhaps you're not familiar with Zoom, but you can usually get to that by hovering over your screen, and it's at the very bottom of your screen generally. And we will ask you to complete a post-webinar survey for us, and that should appear in the chat. And we're very grateful for any information we receive in relation to the specific webinar or in general about webinars organised by the IAOP or suggestions for future webinars, for example. And we might use some anonymised information from the webinar this evening to inform future plans for the IAOP. So that takes care of the domestics. And so we'll move on to the most important topic this evening, and that is the core of the presentation. And I'll introduce the speakers. So we're joined, as I said, by three speakers, a multidisciplinary group of individuals. Firstly, Niamh McMahon, Chief 2 Pharmacist with St James's Hospital and Adjunct Professor in Trinity College Dublin. Professor Graham Hughes, a Consultant Gerontologist and Clinical Lead with the National Clinical Programme for Older People, and Miss Catherine Devaney, HSCP Regional Integration Lead role for the West Northwest Healthcare Region and former HSCP Clinical Advisor for the National Clinical Programme for Older People from 2021 to 2024. So, as I'm sure you'll agree, three highly specialised and highly knowledgeable people. So, I will hand over in the first instance, I think, to Niamh, who will set up this evening's webinar, and we'll get going. So I think Niamh will share her slides momentarily. So just bear with us for a moment. Thank you. Thanks, Niamh. They're coming up there, and we're getting into presentation mode. Yeah, lovely. That's
Great.
perfect. Thanks, Niamh.
Okay.
Yeah, lovely. Thank you.
So thanks very much for the introduction, Mary Claire. I'm delighted to be here this evening with my co-presenters. And over the course of the next 35, 40 minutes or so, we are going to provide you with an introduction by Professor Graham Hughes. Then I'm going to follow on with a little bit of background about the development of the Knowledge and Skills Framework, and to tell you a little bit about the content of the framework. I'll then pass over to Catherine Devaney, who is the former HSCP lead for the Older Persons Programme, and she will talk about implementation, and she will refer to some of the research that was done connected with this topic. She'll explain to you a little bit more as the presentation goes on what the eclectic research involved. And then I'll finish up at the end talking a little bit about application of the framework to pharmacy practice, and then finish up with a summary. So by the end of the webinar, you should know what the Knowledge and Skills Framework is, why and how the Knowledge and Skills Framework was developed, and how it can be used to improve practice and person-centered care in older people, and how the Knowledge and Skills Framework can be used to support pharmacists and advance pharmacy practice. So at this point, I'd like to hand over to Professor Graham Hughes, who is the lead on the National Clinical Programme for Older Persons and a consultant gerontologist. So thanks very much.
Thanks a million. Thanks to the IOP, to Mary Claire and to Audrey and Grace, and particularly to Niamh for the invitation, and also for yourselves. I think there were just shy of 200 people registered for the education session this evening. So thanks a million for tuning in to this evening. I was reflecting on Niamh's title in advance of today. What does it mean for you? And I wear two hats currently. I'm a jobbing geriatrician in Vincent's in Dublin, and I've been the clinical lead on the programme for a period of time. And really, the latter is framed by what's acknowledged as really a success story for Ireland, both with regard to our growing population at over 5 million and close to the numbers of people who lived on the island of Ireland back at the time of the Great Famine, but then also what is our successfully aging population. So we're aging more rapidly than most of our European counterparts. They're ahead of us with regard to this. But in Ireland at the moment, about 1 million of our population are over the age of 65, or about 15% of our population. And over the course of many of our careers, so bringing it up to 2050, that number of over 65 in the population will have doubled to 2 million. And it's not just going to stop there. So although the rate of growth in our life expectancy is slowing down, it is anticipated that by the end of this century, that the average life expectancy for an Irish person will be 90 years. But we wouldn't be in healthcare if we didn't like to identify problems. And what we see from looking at stats such as produced through Eurostat is that the healthy life years of older people really has stayed stuck from the early noughties at about 12 years of healthy living over the age of 65. And from the clinical programs perspective, we have 3 medium-term streams in terms of our strategic plan in trying to address this. The first is looking at healthy aging and the mirror of that, which is frailty, from a population perspective. And we're doing that with our public health medicine colleagues, the Department of Health, the CSO, and the advocacy sector, really looking to get better data with regard to what cohorts of our population are aging well, who isn't, and having that accessible really across the healthcare professional setting, whether it's community setting or whether it's hospital setting. The second then is looking towards adopting an age-friendly health system. And that work stream really comes from a construct which was developed through the Institute for Healthcare Improvement in the US, and has been taken up by most of the healthcare systems in the US, as well as across New Zealand, some of the states in Australia, again through the UK and in Ireland. And what that's focusing on is really around the culture of care and what matters to the person. So really putting the older person at the center of their healthcare in terms of the decision making. And that's a project we're piloting down in the southwest region at the moment with the Oreo there, who's come from both New Zealand and Australia and has some experience in that area. If any of you are interested in that, please reach out through the chat box, and I can put you in touch with people down in the southwest who are leading out on that project. Then the third work stream, which pertains to tonight really, is around workforce. And the first part of that is clearly around sufficient numbers of people who are appropriately skilled and have competencies that are central to the profession. And both Niamh and Catherine will talk a little bit about that. But as important is that they have skills that enable them to navigate an increasingly complex healthcare system so that they can provide care across settings based on the patient's needs. So over the 5 days working of this week, I'll have done domiciliary visits, nursing home visits, a specialty clinic for people with Parkinson's, and worked in the ED. So across very different platforms, and the healthcare professional group working with us within the specialty of geriatrics are beginning to do similarly. So my other hat is as this jobbing geriatrician, and my real love, as I've alluded to already, is in relation to Parkinson's disease, and it has been for almost 3 decades now. And PD for me is the quintessential older adult condition, because it affects people's physical well-being, their mental health, their autonomic system, all of which can threaten their quality of life. And the management reflects disease, which is complex. So the management is complex. And what I know from my practice is that the gains are dominantly driven by the patient, not by the professional. The second is that they meet the right professional for the period of their life where they're at that point in time. And unquestionably, the professional with the highest impact factor for me in the field of PD was an occupational therapist who's just retired from the Royal Hospital in Donnybrook, Paul Diamond, who was able to get benefits from people with therapy that certainly outstripped a step up in their PD meds that I might prescribe. So for the patient in front of you, it may be that there's a therapy focus that's appropriate at that point in time. It might be an activity focus or a social connected focus, and that has to come from dominantly the advocacy sector and from our communities. And then clearly for a condition like Parkinson's or many of the other chronic diseases that affect older people, there's that side of medicines as well. And in PD, as many of you know, there are multiple meds with variable dosing regimes, and the benefits are less predictable and side effects are more predictable as somebody progresses with their condition. And it's probable I've had conversations with quite a few of you over the years where you've picked me up on a prescription error or maybe a side effect or a previous interaction that someone has had with that. So what's really important now in this space, as more of our population ages, is this interplay across decision-making that involves the patient at the center, their family members, nurses, and particularly nurse specialists and advanced practitioners across the healthcare professional group, the doctor, in this instance, the pharmacist as well, and how we can best complement our functions for the best outcomes for patients. And I'm hoping that Niamh will talk a little bit more towards the end around that expanding scope of roles in the pharmacy group, and we'll have some conversation around that at the end. So look, many thanks again for the opportunity to be present today and to contribute to your session, and I'll hand back to Niamh. Thanks, Niamh.
Thanks very much, Graham. So the overall purpose of the Knowledge and Skills Framework is twofold. It is a framework to be used as a guide for interdisciplinary teams working with older people to develop their knowledge and skills. But equally, the framework can be used by individual health and care professionals to support professional development within the area of gerontology. But like I said, I'd just like to take a step back for a moment to how it all began. And just to say as well that my role is that I'm the pharmacist representative on the National Clinical Programme for Older Persons. And originally it was a team of 7 of us who in fact were a subgroup of the National Clinical Programme for Older Persons. We were called the Interprofessional Interest Group, who were established to inform the strategic development of improved collaborative interprofessional working across boundaries of acute to community health and social care. And this was in order to deliver on the Sláinte Care programme goals. So our team of 7 comprised myself, a pharmacist. There was also a nurse, a physio, a speech and language therapist, a social worker, an OT, a dietitian. And a short time later, a psychologist actually joined us as well. So it's long been acknowledged that multidisciplinary team working is an essential driver of integrated care delivery. And we knew that there was a big expansion of services for care of older persons at the time, with the establishment of specialist community hubs, and that also there would be new ways of working and a case management approach for patients with long-term complex needs, such as our frail older patients with multimorbidity. So as a team, we felt that there was a need to focus on interprofessional collaboration. And we knew that this would involve both developing multidisciplinary teamwork and also improved coordination between care providers across the various interfaces. So I'd just like to take a moment just to explain what this concept of case management approach means. One such definition is that it is a collaborative process which assesses, plans, implements, coordinates, monitors, and evaluates the options and services required to meet an individual's health, social care, educational, and employment needs, using communication and available resources to promote quality, cost-effective outcomes. Obviously, in the case of the older persons program, the focus here was on the case management approach as it applies in terms of health and social care. So I'd just like to take a moment to look at the 10-step integrated care framework for older persons, which was developed back in 2016 at the time of rollout of the integrated care teams, and how this interlinks with the work that we were trying to do in terms of thinking about what needed to be done. And we were particularly focused on steps 5 and 6, 5 being the development of new ways of working and looking at new roles, including, as I've alluded to, the case management approach for patients with long-term complex needs. But equally, we wanted to look at the development of the multidisciplinary team and look more closely at how best they would work together, and also how this would all fit in terms of the creation of the clinical network hubs and coordination between the various care providers. I also would like us to take a moment to look at the older persons chronic disease service model. And as you can see up at the top left, there has been a shift left of resources and activity with a view to keeping older people living well at home. On the right-hand side of the screen, you will see acute care. So we have patients cared for within the hospital system, either in our EDs, our AMAUs, with frailty at the front door teams, or as inpatients with bespoke specialist pathways. And under there, you will see the specialist ambulatory care hubs. And here, the focus in relation to our older persons are on the 3 areas of frailty, falls, and dementia. And for chronic diseases, respiratory, cardiac, and diabetes. And then back more towards the left, we see the community health networks, and we see all the various professions represented there, including pharmacy down at round about 4 o'clock there on the dial. So, as I say, our team of 7, which subsequently became 8, got together and decided that there was a need to develop a competence framework. Our overall aim being to enhance provision of integrated person-centered care. And our reasons for this were several-fold. We wanted to have a means of identifying team learning needs, to identify strengths, but also equally to identify gaps and areas for improvement. We hoped that our framework would support team development and knowledge and skills, and also give an appreciation of the various discipline-specific knowledge and skills that each of the team members had. And finally, we hoped that it would act as a resource for training and continuing professional development purposes. We knew that there was a need to engage with key stakeholders, and we identified these to be HSC managers, academia, and we partnered with academics within the School of Nursing, Midwifery and Health Sciences in UCD. And this was the eclectic partnership that I alluded to briefly earlier, and also obviously all of the various professional bodies. So in relation to our key stakeholders, just starting at the top there, the National Clinical Programme for Older Persons, health and social care professionals, pharmacy, the Office for Nursing and Midwifery, our UCD academic partners, and as I've said, the various professional bodies. And our target audience was all healthcare professionals working with older people and across all healthcare settings, so including acute hospitals, community services, and residential care. So I just want to take a moment to look at a definition of interdisciplinary working because there is a subtle difference between multidisciplinary and interdisciplinary as a term. So one such definition from Ellis and Sevdalis is that members come together as a whole to discuss their individual assessments and to develop a joint service plan for the patient. Practitioners may blur some disciplinary boundaries, but they still remain a discipline-specific base. And teams integrate closer to complete a shared goal, which in turn require a team-based approach to be managed, including allied health professionals, social work, and nursing alongside medicine. So as you can see, it's very much a collaborative approach with a shared goal of improving person-centered care at its core. So I'd also like to take a moment just to go through our methodology. And this is not just for the purposes of telling you exactly what we did, but also to take a moment to focus on the learnings from it. So if there are any of you who are considering developing a knowledge and skills framework in a different speciality area, you may perhaps learn from our experiences. So the first thing we did was a comprehensive literature review with critical appraisal. So we wanted to identify if there were any existing gerontological frameworks and if there was evidence in relation to professional standards or guidelines for healthcare and social care professionals working with older people. We also look to identify discipline-specific professional standards and guidelines for each of the professions who form part of the core team caring for older persons. And we wanted to look at other frameworks which had been developed for other clinical populations and contexts. So, for example, palliative care and acute medicine. And the palliative care framework had, in fact, been developed only a relatively short time before we started on our project. And the chairperson was very helpful in providing us with advice and information. We also looked at competency frameworks specific to the delivery of interprofessional healthcare. And finally, we looked at the grey literature for any relevant documentation. So we met on a regular basis, both in person and then during COVID virtually. And we used a process of consensus decision making. And through this process, the expert panel was able to identify 5 domains of shared knowledge and skills, which we felt were common to all healthcare professionals involved in caring for older persons. We each then developed discipline-specific subgroups to identify and reach consensus on discipline-specific knowledge and skills at both core and enhanced or advanced levels. And some of the learning that we had from this, which I would recommend for anybody embarking on a similar journey, is to set a very clear timeline for the project. Because there is such enthusiasm when you get involved in a piece of work like this, so that it can end up evolving over time. And I think it's important that to flag that a lot of the work can be done remotely. People can be assigned tasks, and then when you do meet, to meet on a not as frequent basis, but maybe for a longer period of time, is probably what we would recommend as being most productive. So, as I say, we came up with 5 domains for shared knowledge and skills, and these were principles of gerontological care, communication, roles and responsibilities, interprofessional collaboration, and ethics and values. And I've included the link there to the knowledge and skills framework so that you can have a look at each of these in more detail. I just want to take a moment to note that the UCD group who we collaborated with applied for funding through the HRB and were successful in being awarded one of the Applied Partnership Awards for a project which they did with us on embedding collective leadership to foster collaborative interprofessional working in the care of older people, or for short, eclectic, as I've mentioned previously. And this piece of work has been absolutely excellent and has dovetailed with the development of the knowledge and skills framework. And the Eclectic project developed a step-by-step guide on getting started in developing core competences for interprofessional collaboration in integrated care for older people. And they identified 3 domains. The first being knowledge of the team and the importance of understanding roles and making referrals. The second domain that they identified with us was communication, communicating effectively and sharing information. And their third and final domain, shared decision-making, collective clinical decision-making and supporting the decision-making of older people. I'd like to acknowledge the various authors that were involved in the knowledge and skills framework. So not only was it our group of 8 who came together, but also HSC managers within the older persons programme, plus, as I've said, our UCD partners. So let's just have a look, take a moment to have a look at the framework. As you'll see, it's all beautifully color-coded, which makes it very easy to navigate through and to get very quickly to your own discipline-specific section, if that's what you want to get to. But I would urge you not to rush there without having a look through the other areas at the start of the framework. And these cover an introduction with background, some demographics and policy context, before moving on to the purpose and objectives of the framework, and then touching on key areas of importance to older persons' care. So multimorbidity, frailty, dementia, falls, and comprehensive geriatric assessment. The next part is the 5 shared domains, which I've alluded to, and then we move on to the discipline-specific piece. So just looking at the shared domains, as I said, they're all color-coded and it's a very interactive document. As you can see, pharmacy is in fact blue because green had already been taken. And I'm just going to move on and I'd like to acknowledge the pharmacist subgroup who I had working with me on the development of the discipline-specific competences. Many thanks to them. Again, it was a consensus building process for us to look at the information that was there and then to agree what was to be included within our framework at both core and enhanced levels. So I'm just going to provide you with a brief view as to what it's all about. So if I can just take you here to some core skills. So looking at the first one there, to adhere to the roles and responsibilities that are required to be registered as a pharmacist with the Pharmaceutical Society of Ireland and adhere to their ethical, legal and professional requirements that inform safe and ethical practice, i.e. adherence to the PSI core competency framework and the code of conduct. So you can have a look through the rest yourself, but this will show you that it clearly outlines what the expectations are in terms of core knowledge and skills. If we then move on to an example of enhanced skills, the one I've chosen here is in relation to palliative care. And looking here, examples are active engagement in palliative care medicine's education and training of students, pharmacists, and patient care clinicians of various disciplines, and demonstrating leadership in the identification, development, and delivery of medicines-related palliative care guidance and policy. So I'll just finish up by saying that the KSF framework and the eclectic step-by-step guide very much dovetail and are complementary to each other. And we would urge you to have a look at both, I think you will find the information very useful and helpful if you are working in care of our older persons. So at this point, I'll pass on to Catherine Devaney, who is the former HSCP lead for the National Clinical Programme for Older Persons.
Thanks, Niamh. So I'm just going to speak to some of the work that was done within the National Clinical Programme for Older Persons to support engagement with the framework. So I suppose Niamh has spoken to this, but again, the reason that the framework was developed was to act as a resource for teams to review their areas of strength, but also areas for development, to support CPD planning, to support team working, and to support the identification of educational needs. But Niamh spoke to the eclectic framework. The eclectic framework was developed for the community specialist teams for older people, so quite a specific kind of healthcare setting. The knowledge and skills framework has been designed to be applicable across any healthcare setting, so residential care, acute care, community services that are working with older people. So obviously the framework is going to be used differently or add kind of value depending on the healthcare setting. So you want to go on to the next slide there, Niamh. So the National Clinical Programme for Older Persons worked with HSE Spark to run a systems design workshop, which had the objectives of identifying how the knowledge and skills framework could improve healthcare for older people across different healthcare settings. What were the challenges to the implementation of the framework, and what resources would be required to support its implementation? So that workshop was a half-day workshop. It had representation from a wide range of healthcare professionals working across a range of healthcare settings. It was a really interactive event, and you can kind of see our example of our outputs here on the right-hand side. So they were all kind of analysed then to kind of inform the development of an implementation plan to support services to engage with the framework. So if you want to go to the next slide, thanks. So we asked the group how they viewed interprofessional learning, and it is viewed really positively. So the words that kind of came out really strong in relation to interprofessional learning are collaboration, trust, patient-centered care. And this is obviously how we want to be providing. This is how we want teams who are working with older people to be developing. These are the attributes that we know are kind of associated with good team working. But there is challenges in accessing interprofessional learning opportunities. CPD is generally still provided in a unidisciplinary kind of method, and there's a real scope here for supporting the development of interdisciplinary learning or interprofessional learning. So Niamh gave an overview of the competencies that were identified in eclectic that support interdisciplinary working. And one of the first competencies is that good understanding of the role of other healthcare professionals, but also knowing that the rest of the team that you're working with have a very good understanding of what it is you contribute to the care of the older person. So this was kind of one of the questions that we put to the group who attended the systems design workshop. What are the opportunities for learning about the role of other healthcare professionals? And you can see that this is really happening informally. So teams spoke to being kind of co-located and being involved in kind of team meetings, having the opportunity to engage in complex case discussions, or being involved in service improvement initiatives. But these opportunities are probably easier to access in some healthcare settings than in others. So I think the teams that have been more recently established, such as the frailty, the front door teams and the community specialist teams, probably find it really easier, much easier than other settings to perhaps access these opportunities. And I think it's really important that we look at our service and ensure that we're kind of prioritizing these opportunities to kind of come together with our colleagues so that we can kind of meet the needs of older people who are presenting with kind of frailty or multimorbidity or complexity. So there's only 15% of responses spoke to for or identified formal learning opportunities for learning about the roles of other healthcare professionals. So these were stuff such as a postgraduate course that's offered in Trinity in Aging and Frailty Studies. Also, we have the National Frailty Education Programme. But I think there's a real opportunity here for the further development of learning opportunities so that we can come together and learn in that interdisciplinary way. So again, we asked the systems design workshop, the attendees, what were the opportunities that they saw that the framework presented. So the attendees spoke that it could be used to review service provision. So you could use the framework to identify gaps, where there is gaps in your service provision. I think this is particularly kind of relevant now where we know there is gaps in services. There may not be that full kind of MDT working to meet the needs of the older persons. So I think it's really important that this kind of knowledge and skills framework can be used to kind of to not just look at your kind of discipline specific section, but kind of engage with the other sections relevant to the other professions, and to make sure that you're kind of you're providing that skill set to meet the needs of older people. The framework can then also be used as an opportunity to engage with professions that would not currently be part of the core team. So looking to kind of engage outside of your service, perhaps with kind of community services, to develop those links so you know how to refer the patient on if required. It can support team and professional development. So we know that integrated leadership structure is really important for meeting the needs of older people. And this framework supports that. And it also kind of, I suppose, it helps to really kind of bed in the idea that all of the healthcare professionals are really key to meeting the needs of older people. And obviously it can be used to identify training needs. And actually, just to speak to that, actually, the taking on of new roles, if anybody has attended any of the National Clinical Programme workshops, we've had a number of teams speak into how they have had to kind of widen their kind of skill set and kind of branch out of what had been their kind of traditional skill set to meet the needs of the older people. And that is what we kind of want to see, while still kind of recognizing kind of what is a speciality, what can we kind of competently speak to, and when do we need to kind of refer on to a healthcare professional who has got more specialist services if that's what the person needs, the older person needs. So a lot of challenges were recognised also to embedding or engaging with the framework. So services spoke to change fatigue. They also spoke to kind of needing the time and physically kind of a space to kind of come together as a team to engage with the framework and kind of review its implication for their services. Champions for implementation were seen as being key. The inclusion of all relevant disciplines was seen as being really important to support engagement with the framework. And hopefully when this is just the first version of the framework and when it is reviewed in 2 years' time, hopefully that will be an opportunity to engage other professions who are not part of this kind of current draft of the framework or current version of the framework. With interdisciplinary working, there can be a real fear of kind of role dilution as we're kind of widening out kind of our kind of skill set to perhaps speak to areas that would not traditionally have been part of our skill set. But I think the strength of this framework is it speaks to those kind of core and the enhanced skills. So it kind of provides that direction for kind of career progression and development in the area of gerontology. And then also services spoke to how do we do this sustainably. So we asked for ideas of what would support in embedding the implementation of the framework within services. So attendees spoke to wanting examples of what does good engagement with the framework look like and opportunities to share that. So where services are successfully engaging with the framework, they're asking that would be shared through perhaps kind of webinars. They wanted further resources to support the development of interdisciplinary working. And support from leadership was really seen as being key for services to engage with this framework. So just, I suppose, to give an overview of the progress to date within the National Clinical Programme to drive interdisciplinary working. So the eclectic research that Niamh spoke to is ongoing. We're now in stage 2 of the eclectic research. And in 2024, a realist review was conducted of the literature, and we're hopeful that we'll have that kind of synthesis of the evidence paper published this year. And we have ongoing work going with kind of 4 sites, 4 community specialist teams for older people. UCD is working with those sites to get a better understanding of what are the competencies and enablers that support the development of interdisciplinary working. And all that is going to inform the development of a curriculum to support interdisciplinary working within older persons. So that will be kind of the final output of the eclectic research. In 2024, the National Clinical Programme for Older Persons with UCD successfully applied for a HRB Knowledge and Translation Award to support kind of further dissemination of the eclectic research. And so that is going to be used towards the development of educational resources to support interdisciplinary working, and with a real focus on increasing the awareness around the role of all team members. So that Knowledge Translation Award will very much kind of pull in the knowledge and skills framework as well. And then last year we ran workshops. So those workshops were run with teams working across different healthcare settings. And I suppose the criteria for applying to the workshops was there had to be an interdisciplinary approach to the service improvement initiative. And we got really positive feedback on those workshops, and teams really spoke to the value of having that opportunity to come together with their colleagues, to sit down and in that kind of, I suppose, interdisciplinary way to kind of look at the problem and to kind of come up with solutions to their to the challenges that they had identified within their service. And then finally, we have been looking at developing kind of some educational resources again to support that engagement with the framework. So we worked with speech and language therapists to develop this leaflet. It's an educational resource to increase awareness around how to support older people who are living with dysphagia. So it looks at kind of what's the areas of knowledge that all healthcare professionals and also healthcare assistants who are engaging with older persons, regardless of the healthcare setting, what they need to know to be able to identify a person who may be at risk of swallow impairment, and how to know when to kind of refer them on. And also the kind of the things that we can all do when we're engaging with older people who may be living with a swallow impairment to support them with their kind of eating and their drinking. And there's further kind of resources signposted on the back of that leaflet. So just in summary, I think, this knowledge and skills framework has got real potential to drive service improvement within older persons. We know that better professional development is associated with better patient outcomes, in turn kind of leading to better systems performance. So, I mean, we're very much at an early stage of kind of, I suppose, measuring kind of the impact of the framework. And I suppose if pharmacy is starting to engage with the framework, I'm sure the National Clinical Programme for Older Persons would really be interested in hearing about how it is supporting kind of service development kind of within your setting, your healthcare setting. Thanks, Niamh.
Great. Thanks very much, Catherine. So just coming towards the end of our presentation now, I just wanted to take a moment to say that it obviously is such an exciting time for the pharmacy profession with the publication last July of the expert task force report on the expansion of the role of pharmacy. And obviously phase 1, the extension of the prescription by 6 months from the 1st of March of last year, is already in place, but phase 2 is where pharmacists will be able to prescribe within their scope of practice. The initial part of that is obviously the introduction of the Common Conditions Service, and obviously legislative and regulatory changes will be required, and there will be guidance, education and training to support all of these developments. And so also will there be public and patient involvement in implementation, research and review of the recommendations. But this, as I say, is a very exciting time for pharmacy. And, just to mention it at this particular point, because with the knowledge and skills framework, there is an opportunity there to engage in terms of development of roles and interdisciplinary working, as Catherine has outlined. And just to mention also specific to the hospital pharmacy setting, as some of you may be aware, last year there was approval of the revised hospital pharmacy career structure. And one key part of that was the advanced specialist pharmacist roles. And there are, I understand, in excess of 300 pharmacists who have actually put in applications to demonstrate their competency as advanced specialist pharmacists. And the HSE recognises that the competency areas for recognition of advanced specialist pharmacists are across expert professional practice, working with others, leadership, management, education, training and development, research and evaluation. And some of these obviously speak very nicely to the knowledge and skills framework. And just to acknowledge that older persons care is one of the advanced specialist areas which are recognised. So in summary, the knowledge and skills framework for healthcare professionals working with older people is a framework intended to enhance integrated person-centred care. It was developed, as I said, by an interdisciplinary group with representation from pharmacy, nursing, social work, dietetics, physio, OT, SLT, as well as HSC management and, as I said, our academic UCD partners, and also endorsed by all of the professional bodies, including the PSI. The knowledge and skills framework can be used, as I outlined, to improve practice and person-centred care by identifying team strengths and areas for improvement, by improving team working and recognition of discipline-specific knowledge and skills, and also for CPD planning at both an individual and a team level. And it can be used as a tool to support pharmacists caring for older persons and to support development of advanced practice. Thank you very much. Any questions?
Thank you, Niamh, and thank you, Catherine and Graham. That was fantastic, very comprehensive presentation. So I would invite attendees to post any questions they might have into the chat box, and the relevant speaker can take those. The link, as mentioned at the start, to the feedback survey is in there also, just in case you're interested. But while we're waiting for any questions to pop in, I might start, if that's okay. I'm really interested in I just had a look at the framework there and some of the descriptors relating to the pharmacist. And, obviously there's a huge amount of work and decision-making and consensus involved in reaching those descriptors. But I'm really interested to know what kind of literature base or knowledge base or other frameworks, maybe from other countries, were consulted. Kind of what was the research or academic or clinical research base that was used to inform those descriptors?
Yeah, sure, Mary Claire. Similar to what was done for the shared domains, we looked to various frameworks that were in existence, international frameworks, and some of the ones that we found to be of most use, or that appeared to be most applicable to the Irish setting, was the UK curriculum for older persons that was developed by the UK CPA, and we certainly would very much have used that to guide us. There were also obviously other European frameworks and others from further afield, but certainly yes, that would have been very much part and parcel. And as you said, just to clarify as well, because I don't think I mentioned that, as well as some of the core knowledge and skills, when you get a chance to have a look at the document, there are some some that are specific to various speciality areas. So, respiratory, cardiology, infectious diseases, and so on and so forth. So I think when people have an opportunity to have a look at it, you will find the information contained within it to be interesting and useful to your practice.
Yeah, I think it's really directive, when used perhaps in conjunction with their own competency framework, to identify skills or knowledge gaps. I think it's a really comprehensive starting point there. It's fantastic. Um, the other thing I was thinking about, it's particularly evident how this is relevant to hospital pharmacists and lending into advanced practice, etc. What do you think, or how do you think this could feed into community pharmacy practice, or is that obvious, I suppose?
I think yeah, I think it'll depend on the individual setup of community pharmacists and what their relationships are, for example, with local GPs or nurses in those practice areas, and how interdisciplinary working could be facilitated there. I think just as a standalone document in terms of the individual and looking at the speciality of gerontology. I think if people look at the document and see the various areas that they should develop expertise in, I think it is helpful in that way
Mm.
to identify what areas you do feel competent in, or what areas you feel that maybe you need to address and develop competencies in those areas. But certainly also, with regard to those shared domains, I think it is important to consider that working across sectors and linking in with the various other healthcare professionals, because that is very much a big part of this
Mm.
knowledge and skills framework. And I think with the expansion of the scope of pharmacists with the recommendations from the expert task force, I would be hoping that the pharmacist scope of practice will be developing and that these opportunities will be developing alongside.
Yeah, yeah, I think certainly, having worked in community pharmacy myself, that the vast majority of our patients are aging and older patients with chronic disease conditions, and I suppose having a single repository there of a single place you can look at to examine your own knowledge and skills in relation to that population, which is, takes up in most cases, most of our care is really, a great starting point rather than kind of put some organization on it, doesn't it?
Yeah.
And I really that other point that was made about being aware of what other healthcare professional groups do and what I suppose their expectations, their own role and maybe what our expectations of those individuals would be. Um, I suppose I'm guilty myself of having a particularly siloed or maybe linear view of some professional groups and just lacking awareness because I don't interact with them maybe. So it is, as you say, rather than just skipping straight on to pharmacy, upskill yourself or increase your knowledge on other professional groups. Graham, did you want to come in there?
Yeah, I was going to highlight the iSympathy work, which was a very nice collaborative piece of work across the community setting in Scotland, Northern Ireland, and the Republic of Ireland, which really, very clearly identified the strength and the value that community pharmacists bring, clearly around medication management. But that's just one step away then towards what I would like to see is very much a disruption of that natural hierarchy that's been there within healthcare settings where the doctor is prescribing something. That's already changed. Most of the prescriptions within my Parkinson service are written now by one of the advanced nurse practitioners. So there's a change in that side, but it'd be fantastic to see that scope of practice within pharmacy changing as well. Where, for example, if you were the pharmacist providing medicines through to a nursing home, that you were part of, to residents living in a nursing home, that as somebody began to approach end of life care, perhaps you were part of those interdisciplinary discussions around deprescribing of medications.
Mm.
And that whether it was to do with on the basis of either concerns around polypharmacy and interactions or around futility in somebody with a low life expectancy. And the kind of expertise that pharmacists bring to that conversation is invaluable as against nursing staff, or perhaps even a GP who's there and is oftentimes watching the clock as much as anything else, or even a geriatrician if they're part of it. So I think I would like to see these roles develop, and certainly there's a big, I think the regionalisation of health is going to do that. I think the networks of care within are going to progress on that. And we were thrilled that the older persons cohort were one of those identified under this expansions of practice, because we want you in there very, very quickly. It's just how that's going to be resourced.
Mm. Thank you for that. I think often, speaking from my own experience, pharmacy, maybe we lacked the confidence, or maybe we just didn't have that background, I suppose, in proactively contributing, I suppose, and kind of having the confidence to use our professional voice in that context. I think this maybe provides a framework, or provides a kind of a structure to understand where and exactly how we can contribute. And it gives us, for so long, I think we have failed to put ourselves forward in terms of, this is the knowledge and skill set that we own. And I think, it's a really good starting point for that. Before we finish, I think I'm not sure if this is how we kind of proceed forward this, but this point about interprofessional knowledge and skill, and I know a lot of pharmacy schools at undergrad in particular are really trying to give undergrads that experience of working with other professional groups and getting them in a room together. Are there opportunities for that as postgrads, or as professional pharmacists? Do you know, or I think you mentioned the national the National Clinical Forum, or the opportunity to work together. But is there any, I don't know, so where we can really kind of try and break down those siloed viewpoints. Obviously there is in hospital pharmacy, maybe, or maybe I'm wrong there. Is there any kind of way we can
Yeah,
interact with others?
yeah. No,
Yeah.
it is something that I actually encourage, because we used to have healthcare professionals coming in to speak to us. So, for example, a speech and language therapist would come into us and talk to us about dysphagia, and we talk about the commonalities, and talk about communication issues, and where the pharmacist, may have challenges in terms of discharge medication counselling with a patient who was post-stroke, or dysphagia, and the impact on a patient for swallowing medicines. So that was found to be hugely valuable. But also within the pharmacist's own practice settings, I always encourage them to try to speak to healthcare professionals, about their various roles, and to see where there's overlaps and commonalities, and really how we can support each other in terms of improving patient-centered care.
Yeah, thanks. Great.
Yeah, I'll make 3 quick comments on that one, Mary Claire. The first is that one of the outputs from Eclectic is towards a curriculum around undergraduate interprofessional shared learning. So that's one thing that will give every professional, as they graduate through whatever undergraduate course you're looking at, that's part of what's embedded in that, is that there will be this pitch to the universities with regard to that. The second is I was on to Podiatry Ireland today. They have their annual meeting on in Tullamore in March, and they wanted their day to be about the older person. So they wanted a psychologist and an occupational therapist and a clinician to talk around dementia and health as it relates to the nails and the toes and the feet of older adults. So I suppose part of this is recognizing it within your own professional group, that a component of this is actually reaching out to those professions as well.
Yeah.
And then the third is that in terms of that postgraduate learning piece, I know this is something that the college is very keen to, the Royal College of Physicians is very keen to progress on. The president is a geriatrician as well, and so Dermot this is something he wants to move on. He sees that kind of siloed postgraduate teaching as something that we need, that doesn't facilitate better patient care. So I think watch that space with regard to what the training bodies do.
Yeah, no, that'd be great. As integrating it into undergrad would really strengthen, I think, the way forward here. Well, thank you very much to our three speakers. That's been a really excellent talk. I might just conclude with one or two final slides. Grace, if you have them there, I can. Yep. So as we mentioned, we have the survey link up, but to remind you, to if you could to summarize any learnings you've gained from the session this evening in your CPD cycles, even if you start one now and come back to it. We will have another webinar in 2 weeks' time, and that one is with Martina Blake, the National Lead for the HSC Tobacco Free Ireland programme on stop smoking medicines and how to use them. So again, a really interesting and important topic for us as pharmacists. So without further ado then, thank you so much, Niamh and Catherine and Graham, for that wonderful presentation this evening. I certainly learned a lot from it, and plenty of things to think about going forward. And thank you to all our attendees, and hopefully we'll see you in a few weeks' time at our next session.
Thank you.
Thanks
Thank you,
very
everyone.
much.
Good night.
Bye.
Bye.